record. I don't know if you heard that, but it told me recording in progress, which is great. And I will go ahead and admit them all. You're good to go?
Yeah. Am I sitting in a good spot? I didn't even check if I'm...
Yeah, everything looks great from my side. Looks great. Here we go. Good luck.
Thanks.
Hello, everybody. I just, I'm wondering if I could get a thumbs up to make sure that my audio is working. Thank you, Gayle. Put that through. I think there's some connecting to audio, so perfect. Just waiting a few minutes to let a few more participants in. Okay, I just want to do one more check on audio. If I could get a thumbs up from anyone or a high five, that would be fantastic. Okay, great, thank you. Just wait 1 more minute. Okay, I think I'm gonna go ahead and get started. Welcome to our lecture series. Thank you for taking the time to come and talk, or come and listen to Dr. Gayle talk about insomnia. My name is Renee Westmacott, and I am your host for the evening. I would like to introduce Dr. Gayle Maguire. Dr. Gayle has practiced naturopathic medicine for 15 years. She's been with AST for 12 of those 15 years. And this evening's lecture is on something that we all seem to be affected by at times, insomnia. If you have any questions during the lecture, feel free to write them into the chat box. If you're Swavi, you can put a hands up, high five. Sometimes I get confused if it's a high five or hands up, but I think it's hands up. I will be watching for them. If they are relevant, if the questions are relevant at the moment, I will interrupt and read the question to Dr. Gayle. If not, I will wait until the end. Feel free to stay on the call afterwards to ask any further questions. And please join me in welcoming Dr. Gayle Maguire.
Oh, this is active sports therapy on.
There, you're good to go, Gayle. Welcome.
Thanks, Renee. Yes, if you've got your microphone or on, maybe just turn it off here for the duration here, and feel free to pop it back on if you'd like to jump in with questions. But as Renee said, the chat is a great way to do that too, and then we can either go through them at the time that it's relevant, or we can go through questions at the end. I'm not in a rush at the end here either. But yeah, thanks so much for hanging out with us tonight. I find that this talk is usually pretty popular. As Renee said, there's lots of people that struggle with sleep. As a naturopath, I see it in so many patients, and I can definitely tell you that it's one of those things that's, well, as you probably already know if you're tuning into this lecture, that it's so fundamental. You really can't get people past certain things without good restorative sleep. So it becomes one of those things that I have patients that are taking the best vitamins and they're eating an impeccable diet and doing all the right exercise, but if they're not sleeping, then we've got to look at that at some point too. So I'm going to open up my little presentation here. And at that point, I won't be able to see the chat, so Renee's going to help me out with that. And I hope to speak for about 40 minutes or so and leave some time for questions. Sometimes with Zoom, I find these lectures go even faster, so hope this is helpful to you in some way. Some stats, again, when I'm talking to people that are having sleep issues, this is probably no surprise here, but I think some of the terminology is important. Knowing that there is something called sleep onset insomnia, which is patients that have trouble falling asleep versus sleep maintenance insomnia. These are the people that wake up at a certain point in the morning, in the wee hours, in the middle of the night, and can't get back to sleep. So sleep onset versus sleep maintenance insomnia. When you're talking to your doctor about these problems, that's the kind of terminology and that's the labeling that they might put with that. And then looking at simply just not restorative sleep, it's not restful. So I'll have patients that will tell me that they slept a good 8 hours in their bed. However, they wake up and they feel like they really haven't slept at all. So that also tells us something, and that's important to treat as well, that that sleep depth has to be there, that quality of sleep has to be there. Women, lucky us, we get to be twice as affected with sleep issues as men. Hopefully by the end of this talk, you'll have an understanding why that might be. That sleep is often connected to other healthcare conditions. Here at a clinic like AST, we treat lots of pain and soft tissue work. And I can tell you that there's, pain as a part of why they might be having sleep issues is obviously such a big part of the problems there. Things like restless leg is another thing that as a naturopath, I talk to patients a lot about nutrition and what their body might be a little bit low on, or maybe too much of something going on. So where are those balances that might be creating some of these symptoms too? And again, probably no surprises to anyone that's on this call. If you're having sleep issues, some of the things that sleep affects our perception of pain. So again, in a clinic like AST, where we treat lots of people with pain, sleep becomes such a vicious cycle that you've got a person that's had some sort of injury and it's now affecting their sleep. And without that good sleep, they can't really recover as well as they need to. And so the pain just kind of snowballs from there. We know that, again, sleep helps us with our performance. So whether that's memory or doing our job well, feeling like we're the best parent or spouse, all of those important things. Our cell metabolism, so simply even just the cells dividing properly, is affected by sleep. Our weight and metabolism and all the things connected to that, things like diabetes, high blood pressure, there's lots of studies showing that those are affected by sleep as well. And then I happen to treat a lot of children as well. So I find that sleep and behavior is something that comes up a ton with parents that bring their kids in for things like ADHD and finding that the kid's not sleeping enough. And that might have a big part to play with helping that child with those symptoms. I talk to my patients a lot about two different hormones when it comes to sleep. So melatonin is the one that we all know for sleep. This is the guy that makes us sleepy. And melatonin is shown in this cute little graph here in red. So you can see melatonin throughout the daytime between sort of 6, maybe 7 a.m. and all the way till 7 p.m. that it's really at its lowest point. And then at some point when we're starting to get ready for bed and we're starting to get sleepy, we expect that melatonin should increase. So that red little curve should peak somewhere in the middle of the night, so around midnight or so, that we would expect our melatonin to be at its highest. And then it starts to come down, and that's what kind of makes us a little bit more restless as the morning hours advance and we start to wake up. So melatonin, no surprises there. We expect that to be at its highest in the middle of the night. We expect that to be kind of low during the day. We see on this chart also cortisol. And cortisol is something I talk a ton about with my patients. Cortisol is your sort of get up and go hormone. We think about cortisol as a stress hormone, and that really is something that is elevated when we're in periods of stress, but it's there every day and it's also in a rhythm and it's opposite to melatonin. So you can see that when melatonin's at its highest, cortisol is at its lowest. And when cortisol comes down in the later evening, that's actually what triggers melatonin to be secreted and for us to start to feel sleepy. So if you are someone that's in a high stress situation and your cortisol is staying high and you're unable to bring it nicely down in the evening, you can expect that reflex for melatonin to start to kick in is going to be affected. So we see a lot of people that have stress as a big part of their sleep issues. And that's really the connection there, that cortisol coming down is what triggers melatonin to go up. Other connections that I see with insomnia as a naturopath, for my patients that have sleep maintenance insomnia, so those patients that wake up at 2, 3 in the morning and they're wide awake and they cannot get back to sleep, the two biggest things that I look at with that is their blood sugar. So has their blood sugar kind of dropped too low in the middle of the night? And they may not necessarily feel hungry, but their blood sugar is starting to get a little bit low, and on some primitive level, their body's a little bit restless and a little bit stressed out by this, wondering when their next meal is going to come in. And so this is an interesting pattern to see that, and that's often connected to the next one on this list, the stress connection. So a lot of these patients will tell me not only do they have trouble regulating their blood sugar, that they cannot miss a meal and they get hangry or stomach pains or whatnot when they miss a meal, but they're also maybe living a high stress lifestyle or they've got something significant going on. So stress is another thing that we see also wake those people up at 2 or 3 in the morning. And this, again, might be connected to that cortisol. We certainly see anxiety as something that can really, I think, just cause someone to never really turn off in the nighttime. They might go to sleep, but I think that brain just never really entirely turns off. And they wake up at 2 o'clock in the morning because the dog moved on the bed. They were never really in that deep of sleep, and something little just wakes them up, and there they are. So blood sugar and anxiety, and the two of those are actually really connected. Your stress levels are so implicated with your blood sugar, to the point where your blood sugar, when it drops low, feels again like a primitive sort of stress on your body. And certainly when you're in stress mode, then your body pumps out a lot of sugar trying to get you through that stressful mode. So the two of those, the first two on this list here, those connections to insomnia, I find that that's a huge part of a lot of my cases that I'm looking at. It's just trying to get them eating better to regulate their own blood sugar and managing stress, which of course, neither of those are quick and easy fixes. So I think that's maybe a warning I should start with for this lecture too, is if you're looking for quick fixes with a naturopath, it never is. We're always looking at those deeper issues. For us as naturopathic doctors, we're always interested in looking at kind of that root issue. What started all this? Where did all this come from? How can we avoid having to take vitamins for all of your different health concerns, and can we connect it down to 1 or 2 root issues? So is it a blood sugar issue? And is that someone that maybe had those issues since they were a child, and it's manifested and kind of progressed, and they didn't ever learn to maybe manage their stress well, and here they are in their 50s with terrible sleep. Other connections that I treat a lot with insomnia, I often look at thyroid concerns as well. Thyroid is a little gland in your neck that I always refer to it as your puppeteer for your metabolism. It really dictates how fast or slow everything in your body runs. And when your thyroid is running too slow, your whole metabolism is really quite sluggish. And these are the people that might sleep 12 hours, 14 hours, and not really feel like they've slept much at all. It's not the only thing that can cause that. Iron deficiency is another good example of something that can do that, as well as other infections and other illnesses. But thyroid is on the list of things to rule out when someone tells me that they're sleeping a ton, and it's a change from what they used to be, and it's not restorative sleep. If your thyroid is overactive, this is your metabolism kind of in hyperdrive, and these people have trouble staying calm. They also tend to be those people that cannot keep weight on, which sounds like a good thing, but if it's a hyperactive thyroid, it's not a good thing at all. They tend to be really worked up, and again, their metabolism is going a mile a minute. It usually affects their heart and their digestion, so they get malnourished. It really is a pretty terrible direction for your thyroid to go in. And both of those, both the underactive and the overactive thyroid, can create different looking sleeps. Usually an overactive thyroid might be someone that doesn't sleep too much. And again, they just have trouble calming that system down. Immune stuff, definitely if you are fighting something, you can expect, as we know, when we're sick, we either sleep a ton or we have really restless and terrible sleep trying to fight off whatever we're fighting. Not to mention autoimmune conditions and even, I would say, kind of sensitivities. So in a later slide, I talk about food being something that I treat a lot of with patients. We talk a ton about diet and things like food sensitivities. So not full-blown allergies, but maybe just something that your body is fighting to digest. And if you've ever had indigestion or heartburn or anything going on with your tummy, you can probably relate to how something that you're fighting every single day, that you're eating every single day and fighting every single day, that might also affect your sleep too. And I see this especially with children, actually. The children that have a bit of a lactose issue, or they don't do well on eggs, or whatever that food is for them, that they're often the kids that will do 360s in the bed. They're just restless, they're thrashing around all over the place. And as soon as we figure out what that food is for them, the parents, one of the first things the parents will notice is their behavior, their concentration and their sleep, all those kind of things, along with any digestive or skin issues. So I find food and immune kind of stuff really important to look at as well. And then the wonderful world of hormones. So again, for females being twice as afflicted with sleep issues, hormones ends up being quite a big area that we look at as well. One of my favorite questions to ask a patient, a female of reproductive age, if she's had children, how did you sleep when you were pregnant? How did you feel when you were pregnant? And it's really telling when I get those women that tell me, oh, I felt great when I was pregnant. I slept like a baby. I had so much energy. I felt really revitalized. I felt really vital. And often we look at their hormone levels when they're pregnant, which is usually a state of higher progesterone. And sometimes that can be a little bit corrective for some of these sleep issues. So seeing women that have too low of progesterone can be something that is contributing to their poor sleep as well. Low progesterone is one of the hormones that we see. Progesterone in females has to be also in association with our estrogen levels. So we always talk about estrogen. We have to have a certain amount of estrogen and we have to have a certain amount of progesterone, and then they have to be balanced towards each other. So you can have someone that's got a dominant estrogen sort of pattern by having too much estrogen, or they've got the right amount of estrogen and too little progesterone. And either way, that ratio is off. And those are the kind of things that can create all sorts of symptoms. And for women, that dominance of estrogen or that too little progesterone can be just an absolute game changer for some women, especially, again, these postpartum women that I have that have, especially if they've had a couple of babies and maybe their progesterone levels never really quite balanced again after multiple pregnancies. Maybe they're a little depleted. And, it can be 2 years postpartum, it can be 20 years postpartum. And we look at that progesterone and we top things up there, and it's amazing the kind of improvements that can make as well. So some of the treatments that are out there for insomnia, again, presumably speaking to people that are here tonight that have tried many of these things, but here's a list just in case. All the pharmaceutical things that are out there, so over-the-counter and prescription aids for sleep. And these can be the kind of things that I can't really talk about. So you'll have better people to talk to you about that. But those are often things that might just be used as needed once in a while. And often if it's more chronic, your doctor and pharmacist will have other conversations with you. And that might also include then cognitive behavioral therapy. So CBT is a type of therapy that a lot of medical doctors will refer to, very popular from social workers, and a lovely little technique just to help you kind of learn a thing or two, learn some tricks and some hacks, if you will, on how to correct your sleep a little bit. Cognitive behavioral therapy is really problem-based. So I find it's a type of counseling or therapy that you don't need to lie on a couch and share all of your childhood stories. It really is going in there with, okay, this is what happens when I sleep. Then I start to get worked up about my sleep, and then this happens and this happens. And that counselor can help you kind of problem solve that directly. I can't speak to the importance of exercise with sleep. For my little patients and my adult patients, the patients that are not exercising, that's one of the first things that we should be looking at for sleep. It's at the end of the day, it's one of those things that we really can't avoid. And we just have to be careful with the timing of it. I have plenty of patients that exercise right before bed and they get their cortisol levels up again, and that melatonin cannot kick in. We also know that even for some patients, based on what's going on for them in their life at that time, that maybe a lot of high intensity exercise is just not appropriate for them. There's some studies that show us that if you're in already a high cortisol, a high stress state, and you do a lot of high intensity exercise, that can actually increase your cortisol even more. And for some people, maybe they'll actually get better results by taking a little bit of a break or downgrading it a little bit. Obviously, we don't want to remove it entirely, but maybe they're the patients that need to work in more yoga or something relaxing. Even just a walk around the block might be more helpful to their exercise, to their weight, to their sleep, to all of those goals that they might have. There's certainly manual practices out there, manual treatments that can help with sleep as well. Massage is one of the best things, of course, we all enjoy that. For many of our patients that are in pain, that's often a maintenance kind of thing that they have to do massage every month or every other week or whatever it is that takes it for you to feel better. A good option in there, something that a lot of my patients will alternate months with, acupuncture. I'm going to talk more about that in a moment. Hydrotherapy, I've also got a slide for that one. And then herbal medicines and dietary things. So a couple of those points I'm going to highlight here. Just starting with the basics, which everyone knows. When you're on a Zoom call about insomnia, you can assume that everyone has tried the basics. So they probably are already sleeping in a dark room. Some of the old naturopaths that were the pioneers of my profession, they would talk about the kind of things that they would do to darken a room. So, they would duct tape a blind shut. They would put a newborn baby in a closet to help them with their melatonin regulation, all sorts of funny things that you can do. But really, yeah, the darkness, especially in this day and age with screens and a lot of people on their Kobos or their phone before bed, that's actually quite a big thing that can make a big difference in sleep. Having a consistent and relaxing routine is so important. And then for a lot of people, not napping. There's an odd exception to that. There's some conditions that I've seen where they're so depleted and so run down that they need to nap a little bit, and then that actually helps their sleep. But for most of us, probably counterproductive. There's definitely the things in the daytime that we talk about as well. So talking about timing your exercise, really important though, I find, to look at those last few hours of the day. So what kind of things is that person doing from sort of supper time onwards? Alcohol consumption is one of the big things that comes up for a lot of my patients. They find many of them that they just either enjoy it or they're actually using it to help themselves sleep. And it's a depressant. It usually does a good job of helping someone feel drowsy and getting them to nod off. However, the problem with alcohol, not to be too extreme with things, but what alcohol ends up doing is that whole blood sugar thing that we mentioned, those patients that are waking up at 2 or 3 in the morning because their blood sugar has dropped, alcohol makes that even worse. So alcohol really exacerbates that blood sugar dip in the middle of the night. And a lot of my patients, I find, especially women over the age of 40, 35, 40, around there, that's where a lot of my female kind of perimenopause or even pre-perimenopause, they really start to notice that connection with alcohol affecting the quality of their sleep. And those are just the early stages of it. So that's one of those things that we talk about, saving alcohol for certain nights and maybe not making that a regular thing if the sleep is a problem. Looking at medications that you're taking as well, and then vitamins too. I of course, as a naturopathic doctor, I talk a lot about vitamins and supplements and herbal medicines, and it's always so important for me to go through them with patients. I have patients that are taking things that are quite stimulating right before bed, and all we have to do is just switch that to the morning. Same goes with medications as well. There's plenty of medications out there that can be kind of stimulating too. So make sure you talk to your doctor, your pharmacist, or your naturopath about what kind of things you're taking, and are you taking them at the right time of day? Other things that we like to look at as well is their bedtime snack. So for some patients with that blood sugar issue, one of the best things that we can do is help to retrain that blood sugar. And you can imagine this is not a quick process. This is something that's going to take some time, but after a couple of weeks, usually we start to see some improvements in sleep if they start having a little bit of a bedtime snack. So we have patients take something small. We don't want them gaining a bunch of weight by eating a bunch of things right before bedtime. So we have them maybe doing a small handful of nuts or pumpkin seeds are two of my favorites, walnuts and almonds in particular. They have a little bit of tryptophan in them, which is the same sleepy amino acid that turkey has. So those kind of things make a fantastic bedtime snack. They've got a good dose of protein and a good dose of healthy fats. And both of those can be helpful to creating that atmosphere in the blood sugar that is conducive to sleep and restfulness as well. We say that, and then on the flip side, there are some people that absolutely should not eat before bedtime. So it really becomes a trial and error thing. That there's some patients that their stomachs are just too busy, that they're too bothered and too distracted, I think, trying to break down their food, and do much better by maybe intermittent fasting, or at least maybe not eating after 7 o'clock at night sort of thing. So really this is a conversation of saying, have a look at what you're doing and maybe try the opposite perhaps. Supplements to, I think, not necessarily avoid is what I've put on here, but that might just be overrated and you've probably already tried these. Melatonin I find great perhaps for occasional sleep issues. However, for most of my chronic insomnia patients, it's really not the mechanism. It's not about melatonin for them. It might help. We might do it for a few days and see if we can reset some things. But beyond that, it's certainly not something that we should have to take every night. And we still don't know if that's an appropriate thing to take every day, if we're going to interfere with our body's own production of melatonin. So we don't recommend that patients take melatonin regularly. Melatonin has other neat properties to it. It's an antioxidant and have some other benefits there, but really for sleep, it's a once in a while, my shift workers, the jet lag kind of patients, it could be okay for them. There's a few people too, about 1% of patients that take melatonin that actually get the complete opposite reaction and they're actually quite stimulated by it. So that's out there as well. And the same goes for valerian here, which is a plant that is widely useful for sleep for many people. Again, for the odd percentage of people, it makes them worse. And same thing, for me, it's just as needed, and it's not usually getting to the mechanism of low progesterone or poor blood sugar and all the other reasons where I find most of my patients are having chronic insomnia. And again, reviewing those supplements with your healthcare provider. I wanted to touch on technology because that, of course, is so important right now. Using technology with your sleep issues could be something that's helpful. And again, I just mentioned it's so important to try and avoid that in the hour or two before bed. I've got 3 kids at home, and something that you'll notice if you're in my house after supper time, after about 7 o'clock at night, is I start turning down lights and I start switching to lamps and dimmers. And overall, the light in the house starts to come down, and I hope that helps my kids get a little bit sleepy. And for us as big people, hopefully it helps us as well. And we just want to watch the screens right before bed. There are filters, there's blue light filters you can put on there, or simply just finding something different to do that doesn't involve a screen. That being said though, if we do want to harness the good things that are in technology, there are some fantastic YouTube videos for bedtime yogas, for guided meditations for sleep, for meditation, or for self-hypnosis, or simply just apps that are related to those as well. And then white noise. That's all on YouTube. You can find any of those that you could YouTube and just do a little search on there and see if there's something in there that can be helpful too. One of my favorite things to talk about with patients is hydrotherapy for sleep. We all probably know the benefit of a warm bath, especially maybe with some Epsom salts in there and how that makes you feel. And certainly a great part of a bedtime routine, absolutely. A couple of my other not so well-known ones, the cold water stomp. So this is something that I learned in school many years ago, that you put an inch or two of freezing cold water in the bottom of your bathtub, and you safely have maybe someone that you're holding onto or holding onto the wall. You want to be careful with this, but you are stomping around in that bathtub for a couple of minutes. No more than 2 minutes is usually all that's needed. It's quite a quick little stomp through ice cold water, and it's believed that there's something perhaps just exhausting about trying to warm yourself up or stay warm through that process. You don't want to be chilled by this. We don't want you getting a cold, of course, but it should be quite stimulating to your feet. And again, what that seems to do for the body can make some people quite sleepy. I have the odd patient that's done the opposite, but it sure didn't hurt to try. And then constitutional hydrotherapy is something that you would usually go to a spa or a clinic for, and they would do alternating hot and cold with you for an appointment might last up to an hour. And that's the kind of treatments they would use in the old days in the sanatoriums and those sort of things. And those can be lovely for all sorts of different things. I use those for immune and lymphatic health, and sleep can be a nice sort of side benefit of that. And like so many things, the best treatment is the treatment that works for you. Acupuncture is one of my favorite things to do here at the office. I'm trained in the Chinese style of acupuncture. I love all the other styles, Japanese, IMS, dry needling, all of those too. But specifically for sleep, I find the traditional styles are what you'd want to try if you're up for it. They tend to be really holistic. They're looking at the whole person. So in Chinese medicine, we talk about the yin and the yang, and that someone might just be too hot to have good sleep. And we can use points that will cool them down, and sure enough, their sleep vastly improves. What I like about acupuncture is that it can be so quick and, again, treat the whole person. So if they've also got headaches or skin issues or digestive issues, that can all be improved by acupuncture as well. Depending on who you see, appointments, you could expect to spend 30 to 60 minutes usually in an appointment. We have 2 acupuncturists here at AST, myself that does acupuncture as part of my naturopathic practice, and again, many other practitioners that will do it as well. And often I have patients that feel that it's doing something even after the first visit. And for lasting results, I find it's the kind of thing that you want to do maybe every week or every other week for a few treatments, and it sort of builds momentum. So if you've got 24 hours of good results after the first one, you'll get maybe a full week out of the second and a full month out of the third, to the point where most people find the best results between 4 to 6, 4 to 8 treatments. Not everyone, of course, but roughly that's the kind of thing that if you gave yourself once a week for a month as a trial, that would be a really good start. And if you're not needle phobic, if you're okay with trying these things out, it's usually quite a relaxing and invigorating sort of treatment. And then other things that you may want to look into, talk to your doctor or your naturopath about. Magnesium might be something that could be a sleep aid. It's not for everyone, and there's certainly issues with taking too much of that, but something to look into for what it can do for muscle health and relaxation. Obviously, we've talked a lot about cortisol tonight and stress management, and there's specific herbal medicines that we use and vitamins in naturopathic medicine that can help balance cortisol. So even if you're unable to really avoid the stress, we have certain things that we can do to mitigate the damaging effects of cortisol in your body. So bring it down enough that it's not creating perhaps as many issues. And really quite simple things. There's lots of different options out there, and it's a matter of just finding the right one for that person. In addition, there's also simply calming herbs. So a lot of patients know about chamomile tea, and they've probably been there and done that with chronic insomnia. They're quite mild. Again, maybe nice as a part of a big routine, a big bedtime kind of calming thing. But by themselves, probably too mild for someone that's got major sleep issues. And again, probably not the right mechanism either if it's more about their hormones or their blood sugar. Calming herbs will feel nice, but they're not going to probably address that as deeply as that person needs. Dietary changes and food, another big area that you can talk to your doctor or naturopath about, looking at whether you're just reactive to something and is that creating some restlessness, or is it time to try a new diet such as intermittent fasting or keto or some of these other ones that are out there. Some of them might be helpful for sleep depending on being evaluated and seeing what makes sense for your case. And then hormonal support. Generally speaking, naturopathic and functional doctors will have lots of different options there as well, whether that's vitamins or herbs or bioidentical hormone replacement. There's some nice options there to try and balance those hormones a little bit, and great results I find with that. I have plenty of women, like I said, that they might be 20 years after having their kids and go, I've never slept this well since I had my kids. So I think that's a big source of hope. If I can impart that tonight, if I can't legally give too much specifics, everything here is just for educational purposes tonight. But if I can impart some hope that there's certainly some things that could be looked at and some great natural remedies that are out there for sleep, as long as we figure out where the root issue is. So just to kind of wrap up, looking at stress, looking at your food intake, looking at those hormones, those are kind of the big ones that I really find myself treating a lot with my patients. And looking at acupuncture is a great option. Depending on your benefits, you might have a certain amount of benefits for a naturopath. You might have a separate category for an acupuncturist, so you can't really lose either way. And saliva hormone testing is another great option for looking into cortisol and progesterone and estrogen. A lot of the private labs that I use will combine all of that into one sort of package. So we just do one saliva test. Newer labs are also doing urine. So these are great, especially with COVID. Right now, the labs are quite backed up. So if we can do private labs and avoid having to do a blood draw, that's really great. And some of your insurance companies, your benefits from work might also help pay for that, which is really nice. So again, hopefully a couple of things to look for today. Some things to avoid or not bother trying too much if you think that you can connect. If any of those sort of resonated with you, that that makes sense. I might need to look into my hormones. I'm hoping that at least I gave you some ideas of what to look into next for your sleep issues. So I appreciate everyone coming tonight and logging on with us, and we hope that that was helpful for the AST community. I'm going to close up my screen here and see if there's any questions.
Thank you so much for that, Gayle. Lots of excellent information and things to think about regarding insomnia. I personally noticed a few years back that alcohol is directly related to lack of sleep for me, and decided to quit it because it wasn't worth that. So it's great to hear an expert speak on those tiny little things that do affect our sleep. I think we can all say when there is a lack of sleep happening, it greatly affects all aspects of our life. So it's wonderful to see some options and a practitioner and a team at AST that are willing to work with you to help with these fine details. Does anyone listening have any questions that they'd like to speak and ask, or just write in the chat box, whatever is easiest? If not, I'll go ahead with our conclusion. So I want to thank Dr. Gayle for your knowledge and your clear explanation of some of these life-changing methods around insomnia. I highly encourage anyone who is suffering from insomnia to book in with Dr. Gayle and have a conversation with her about what treatments might work for you. We would like to thank everyone for your time. It is valuable, and please keep your eye out for some upcoming newsletters with more exciting lecture topics in our lecture series throughout this winter. And yes, I think with that, if there are no questions, one more thank you to Dr. Gayle for all your information. And one more thank you to the community for being here. Yeah, everyone have a wonderful night. Bye.